The practice of fat grafting is most often employed among cosmetic surgeons as a way to make the face appear younger by adding more volume. But a new report in the latest journal edition of the American Society of Plastic Surgeons says the technique is also viable for people with facial trauma or malformation.
Trauma patients frequently can have an absence of fat or a loss of fat because the actual physical trauma will destroy fat cells. If we think about bone, fat, and skin, fat's probably the most delicate of the tissues that get injured in trauma. And therefore, the skin may be intact, the bone may be intact, but the intervening fat can get smashed, destroyed, and ultimately atrophy or go away. And as long as those surrounding structures are still okay, we may have the ability to inject fat once again and get it to live if there's an adequate blood supply and not too much scarring.
Typically, a cosmetic surgery patient will have fat taken from the stomach or thighs and then injected under the cheekbones, for example, to produce more fullness in that area. The new study looked at results for 100 patients who had undergone fat grafting to address structural issues in their face caused by injury or birth defects. Patients were questioned about the outcomes about 2 years after their original procedures, and the results were also assessed by a 5-member jury. Overall, 74% of the patients were satisfied with the results of their grafting operations, with minor complications reported in only 3% of the cases. These subjective surveys rated the results at 14.5 out of a possible 20 points. Interestingly, the panel of 5 physicians who examined the results objectively rated those results a little lower, 13.9 out of 20. The study showed that fat grafting works best in the mid-facial and lateral cheek areas, with lesser results on operations that involve the upper and lower lip.
This is a great study because it confirms what we already know based from previous information and what we know from our cosmetic surgery experience, that in the right individuals, fat is the ideal filler for both reconstructive, congenital, and in many times cosmetic cases. It tells us essentially 2 things. That fat is excellent in the mid-face area. Why? Because there's not a lot of motion in this area. And when there's not a lot of motion, fat can become stable and become nurtured by the tissue's own blood vessels and blood supply. It also tells us that fat doesn't work as well in the lower face or mouth area because all the persistent motion does not allow the fat to be stable and get nurtured and become one. And this is experience we've known in cosmetic fillers for a long time. If the surrounding tissues are healthy and can provide a good blood supply to injected fat, that fat should live forever, or certainly as long as one's own natural fat lives. Unfortunately, particularly in the reconstructive situation, sometimes the surrounding tissues are so scarred in, or there's an absence of transferable fat, that you need an alternative. And today we have very good choices in dermal fillers that we can take off the shelf. They will live in environments where fat won't, and therefore they're a good second choice and sometimes a good first choice depending on the situation.
Overall, researchers found that fat grafting is a simple and efficient technique for restoring facial volume in patients who have soft tissue deficiency regardless of the cause.